Welcome to this documentary series where we're going to be discussing the challenges of hemophilia treatment and how emerging therapies will address these challenges of hemophilia treatment going forward. My name is Guy Young. I'm the director of the Hemostasis and Thrombosis Center at Children's Hospital Los Angeles and a professor of pediatrics at the University of California Keck School of Medicine.
Hello, I'm Dr. Stacy Proto, pediatric hematologist at Boston Children's Hospital and medical director of the Boston Hemophilia Center.
Well, my name's Glenn Rakosnik, and I'm a severe factor VIII hemophiliac. It was discovered when I slipped in the bathtub and cut my lip when I was 16 months old. And consequences of that was I almost bled to death because they kept saying it was worried mom, new mom type thing, even though I was the fourth child. And I'm the first one in our family that's been documented with hemophilia. So after my parents came to grip with having a hemophiliac, life was kind of normal. We did what we do as kids, played around, got hurt, ended up in the hospital. Eventually, my parents moved from Chicago out to Lisle, and they had a house built. So it was a new subdivision. So I had all sorts of places to play, like all the new construction. So I learned to climb new construction and get hurt. And we dealt with that as just cuts and bruises type things until maybe I would twist a knee or bang an elbow, and then I'd end up in the hospital, which was quite different than it is today. That would require you being in the hospital for like a week at a time, where they would drip plasma, lyophilized plasma, at 3 drips per minute. So I would spend days in the hospital. So that's the type of treatment we had until one time I was at a hospital, taken into the hospital. Our family doctor had switched specialty, so he was no longer taking care of me, and we went in and we were supposed to see a hematologist who refused to see me. So my mom called the chapter, and they said take him down to Michael Reese Hospital, which no longer exists. But I went in there, and they hooked me up to start the IV and hung the bottle of lyophilized plasma. And they opened it up, and it was just running into me. My lips turned blue. I was freezing. We're like, what are you doing? And the doctor said it doesn't do any good to have it in the bottle. So there was a whole evolution of change there. And then it was a few years later, cryoprecipitate was introduced, and we started with that. But that, I could have that at home after my parents showed that we had a freezer that was cold enough to store it. So we started that at home, which was an interesting experience because it was very fibrous, very thick, and we had to thaw it out. There was a whole procedure that my mom would go through, and who had been trained by the doctors to administer it at home. So we started that. And then wasn't that many years later that the first of the factors was introduced, and we started on that. I think I was the 5th or 6th patient in Chicagoland to be on that. So that was a big evolutionary change because we could store it in a refrigerator. We didn't have to put it in the freezer, and it was much easier to mix and much quicker. So each time we were increasing how fast I was getting the medicine versus, having to drive an hour to the hospital and getting through the ER and then getting the stuff. Now we were doing it in minutes. So it was a life changer. I'm using an extended half-life product that works really well. And I've been on that or with that product for 5 years, I believe. Advantage, I would say, is it's a longer half-life product. And that being said, I don't have to infuse every other day. I'm every 3 days. I could push it to every 4, but I have found that I start getting too sore. My joints start hurting, and I'm like, you know what? Just treat every 3 and I'm fine. I volunteer at a food pantry, and I do that on Thursdays. And yesterday I was there for 9.25 hours on concrete the whole time. I probably put in like 14,000 steps. I woke up this morning. Yeah, my legs are tired. They're sore. My feet hurt. Maybe my back hurts a little bit, but I'm able to do that. I can go out and do whatever I want today. I'm not going to end up sitting there for 3 days, dealing with a sore body. It allows me to be mobile, allows me to do things I want to do and enjoy life. Disadvantages, I guess you still have to do an IV. I start my own IVs every few days, and I've learned to do that. It took me a long time to accept that responsibility, where my wife was the one who would infuse me before. But then I watched 8-year-olds doing it, and I'm like, oh, if they can do it, I should be able to do it. So I eventually said, okay, I'll do it. But that's really the only disadvantage of traveling with it is a piece of cake.
I would have to say part of the greatest challenge with hemophilia, especially for my families who are just hearing the diagnosis for the first time, is a lot of the language that we use around what hemophilia is, the risk of bleeding, all of the different treatment options. It's a lot to take in, especially with many of my patients not having a family history of hemophilia. Certainly some of the moms of my patients have had fathers, uncles that have gone through this. They have cousins with hemophilia, and so they're pretty familiar with what to expect. But when you're a new parent, for the first time hearing about hemophilia and the risk of bleeding spontaneously, the risk of bleeding with physical activities, it's very daunting. We have a number of really good treatment therapies that we're able to speak about, but they're injections, they're subcutaneous injections, they're IV infusions. So they're quite invasive in that regard. So that's a lot for families to say, gosh, I'm going to be responsible for doing that, or I now need to partner with home infusion nursing and people coming into my home regularly. Those treatments don't cure my child. They don't even fully protect them for long durations of time. So what does that mean for the bouncy house birthday parties, for playing soccer and other sports and activities? The fluctuating amount of protection they have. Will they have bleeding? Is this safe to do? If there's a small head bump, is this panic worthy? Or is it, just part and parcel of being a toddler, a school age kid? So I think the terminology, the unknowns, sort of everything extra on top of that baseline level of anxiety, especially that all new parents feel, but even as kids grow older and hit school age, hit the teenage years, it becomes a lot.
And yeah, Stacey, I couldn't agree with you more. I think when we think about children, as you said, the other part is just the anxiety of the parents. And I've had parents who tell me that they can't even really sleep at night, concerned that, when we tell them there's bleeding that can happen in the brain, which in the young kids it can happen, that they wake up every 2 hours checking on their kid. Are they still breathing? Are they still, alive? And things like that. And, that sort of anxiety is just on top of the normal anxiety of being a parent of a young child. And then as the kids get older, all of this, sort of mental health, anxiety issues just changes. It's not better or worse. It just changes. So some of my parents, like the first time their child goes on a play date to a friend's house when they're 4 years old or 5 years old, it is very anxiety provoking for them. I mean, when they want their kids to be able to be like other kids, it's very important for them. But then at the same time, they're like, well, do I tell the other parent my son has hemophilia? And then they're like, well, what is that? And then they'll freak out and they'll cancel the play date. Or do I not tell them because probably nothing's going to happen anyway? So even like those kind of challenges are things that, parents of kids who don't have hemophilia don't have to think or worry about. And then it just continues into the teenage years where then kids start doing stuff on their own and they don't tell their parents that, yeah, I rode my bike without a helmet and we were doing flips and yeah, I did fall, but I think I'm fine and that kind of thing. Or they don't even report it to their parents, right? So, all of the anxiety part is a big part of hemophilia that often doesn't get talked about. But yes, you did discuss sort of the treatment burden, the injections, repeated. There isn't like an oral treatment, and there isn't a long-term treatment. So that does create a lot of issues for sure.
And that engagement with others, I think, is really important. So whether it's a play date or needing to put a youngster in daycare or when they first go to school, needing that balance of making sure that caregivers are aware but not overprotective. Because a lot of times, like you said, when folks are not familiar with hemophilia and now they learn that a youngster in their charge has a severe bleeding disorder, even when they're on prophylaxis, that creates a great amount of angst for that provider, child care provider. So they tend to say, great, little Johnny should, sit and play with Play-Doh. Everyone else is going to go out and play tag. Or little Johnny should stay on the stairs while we do physical activity for today and gym and things like this. So making sure that we help empower parents to feel confident about the prophylactic treatments that we have so that there is a degree of safety, appropriate caution, but a degree of safety so that kids are socializing normally, playing, not just always being excluded, put in one place saying, oh, you can't do this, you must stay in your bubble, because that has a lot of important health implications for just normal development, for feelings of self-worth and confidence and things like that. And then you're absolutely right. As those youngsters grow up, many things can happen. But if they've been, cloistered over here in one place, they may not feel as good about joining school activities, or they may feel more shy, or they may say, gosh, I should embark on these activities without telling adults, because if I tell anybody, they're going to try to restrict me and I really want to be engaged. And so then we find out a lot about various injuries and things like this that happen after the fact.
Yeah, it is. It's really about striking balance, which is exactly what you're saying. Is, we want, kids, teenagers, adults to be able to live as normal a life as possible. And really, the treatments we have more or less allow for that. I mean, they have to continue with their treatments and maintain their prophylaxis and be adherent. But I mean, if they do so, they really can live as close to a normal life, essentially, as possible, playing sports and being active and engaging in the social activities, as you said, that everybody can and should engage in as well.
I think our models of care hopefully really facilitate that as well. So through the Hemophilia Comprehensive Center, we have social workers. Some of our groups also have psychologists. I feel like those individuals can be particularly helpful, not only with patients, but with their parents, with siblings, where there's often, additional challenges of being a sibling with someone with a chronic medical condition, certainly with a chronic severe bleeding disorder, to help individuals manage those feelings, manage that anxiety, manage those expectations, and come up with coping strategies, coping mechanisms, ways of effectively communicating with each other. And then certainly leveraging, the robust bleeding disorder community through our local national chapters, where we have bleeding disorder families who are able to come together so that kids of similar ages with similar bleeding disorders can be with other children that have something similar and can have some shared experiences. But very importantly, especially for our parents of young patients, having parent supports. They may not know everything about the bleeding disorder or everything about the treatments, but they know what that anxiety is like. They know what questions that they had. And so having almost a mentorship role for some of the older parents, having a peer role for some of the parents with children of similar age, I think my patients and families report have been incredibly valuable in terms of resources.
Yeah, absolutely. I think both the multidisciplinary team that you mentioned, most of our hemophilia treatment centers in the U.S., it's not just any social worker or any psychologist, or it's somebody who really knows and understands hemophilia because they're embedded within the team and can provide the type of information through their own learned experience working with patients. But yes, and the mentorship too. I mean, I think the hemophilia community is generally pretty tight knit. There's a lot of advocacy and all the organizations, the local ones, where most of the families will engage and most of the patients will engage. Can provide that kind of mentorship, as you said. The older patients, the adult patients, passing on the information to the younger patients. The one thing to be cognizant of, though, is that as we get newer treatments, some of these older patients didn't have access to those, and so their lived experience could be a bit different, and so we have to be a little bit wary about what some of the information that gets passed to either the younger kids or to the parents. It's like, well, yeah, but it is a bit of a different era. So it's always this dynamic shift with the new treatments that we have to keep in mind. But no, the mentorship part about living with hemophilia and being able to have a job and get married and have kids and all of that is something that's really important, because for every kid, every teenager has dreams and goals, whether that is to have a family or whatever career they want to do. And I think it's important for us to relay to the families that and to those patients directly that, yeah, you can basically do more or less anything you want. I mean, might shy away from a career in professional football, but maybe apart from that, more or less anything that they want to do, they should be able to achieve, even having hemophilia.
The generational changes are really interesting, right? Because of course there's just inherent changes as we go from generation to generation, thoughts, goals, ideas, but we also have these treatment generations, as you were talking about. And so for many of my patients, being a primarily pediatric provider, we kick off very early with prophylaxis. When I first started, our goal was, by 2 or 3, be sure we have the most severe bleeding disorder patients on prophylaxis. I feel like each year that's crept down. And so then it became, well, certainly by 9 to 12 months, we should be thinking about prophylaxis. And as we've had newer therapies, let's start prophylaxis even sooner.
Mm-hmm.
I feel like what that has meant for many of my patients now who are school age or entering teenage years, fortunately, many of them have never had a joint bleed. Many of them have never had a bleed at all, maybe save for a rogue nosebleed or something like this. So their perception of their hemophilia is very different, even from the 30-year-olds or 50-year-olds today who had a very different experience in childhood. So sometimes those patients of mine are pretty fearless because they say, well, the doctor, the parents, they tell me I have this bleeding disorder, but I've never bled. So they push the limits in different ways that some of the older generation would have appreciated. I'm going to do that. I'm going to bleed. I'm going to, have the repercussions of that, but it's worth it to me. I feel like some of the challenges with treatment adherence, with activity cautions, are that some of our prophylactic agents are really good. And so that children don't have that same perspective on their bleeding disorder that perhaps some of the older generations experienced.
Yeah, no, absolutely. I mean, prophylaxis, as you said, we would hope to start by 2 to 3 years. Then it kind of started to shift to 2 to 3 months, and now it's even 2 to 3 weeks in some cases. And you're absolutely right. There are patients who are teenagers who haven't had a bleed, which is great, except that the one issue is they don't even know necessarily how to recognize a bleed. And so that's the part that gets challenging. We have to keep drilling into them that, no, I know you haven't had a bleed, and you've had a fantastic life growing up so far because we've been able to control your hemophilia, but always making sure that they're aware that at any one moment, something terrible could happen, particularly if they don't continue with their prophylaxis, or even if they do, and there's even not a serious trauma, but some kind of trauma, that it could really result in something potentially catastrophic. So it's always, again, it's that striking the balance. Yeah, you're good. You can do whatever you want and just keep your treatment going. But by the way, if you feel this symptom or if you feel that symptom or this, please get medical attention right away.
We want to be supportive. We want to be encouraging, but there's always a little but at the end that I think makes it challenging.
There absolutely is.
Hello, I'm Lisa Baggio. I am an adult hematologist, and I work at Rush University Hemophilia and Thrombophilia Center in Chicago. Adults with hemophilia also suffer from increased disease burden as well. Primarily, for many of them, it is time off of work or inability to go into work or to do certain jobs. These patients often have joint disease. They have difficulty with their knees or ankles or elbows, and there are certain things they can't do. So if there's a bleed, they cannot perform certain work duties or even travel into work. Therefore, having a job that is flexible for them is a very big deal. There are some patients, as time goes on, that their joint disease burden makes it impossible for them to have a steady job, or perhaps their previous job was in construction or carpentry or something that was more physical. And over time, they're not able to perform those duties because their joints just don't allow that to happen. The other thing that is a burden is sometimes is with family things. For example, if they want to go to a local fair or something along those lines, they often avoid doing some of those activities because all the walking around and that even gentle activity can bring on a bleeding episode.